everyone. It's your good friend Wendy, and you're listening to the Reaching Out with Reach podcast. This is the show that brings you discussions and topics surrounding our community, prevention, and recovery. Today's topic comes from our very own Brenna, our youth recovery leader. Take it away, Brenna.
Happy Pride Month, and welcome to today's podcast where we will be discussing mental health trends among LGBTQ plus youth. These youth are at a higher risk of experiencing substance use and mental health issues due to various factors such as discrimination, bullying, social stigma, and social isolation. As societal attitudes towards LGBTQ plus individuals have become more accepting, more people feel comfortable seeking mental health support. This trend highlights the importance of creating safe spaces and accessible resources for LGBTQ plus individuals. The rise of teletherapy and digital mental health platforms has made mental health support more accessible to LGBTQ plus individuals, particularly those in rural or isolated areas. If you or someone you know is struggling with substance use or mental health issues, there are organizations that specifically cater to the LGBTQ plus community. The Trevor Project offers crisis intervention services, including a 24/7 hotline. Another great resource is the National Alliance on Mental Illnesses, also known as NAMI, which provides education and support for individuals affected by mental illnesses. Another resource is the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, SAMHSA, which provides information on treatment options for those struggling with substance use disorders or mental illness. They also have a national helpline available 24/7 for anyone seeking information or support. Another great resource is the LGBT National Help Center, which offers free and confidential support to those in need of someone to talk to about their concerns or struggles. They also provide resources for finding local LGBTQ plus friendly healthcare providers. You can reach the Trevor Project 24/7 hotline at 866-488-7386. The 24/7 line for Substance Abuse and Mental Health Services Administration, or SAMHSA, can be reached at 877-836-1526. As always, the Suicide and Crisis Hotline can be reached 24/7 through text or call at 988. Despite progress, individuals still face higher rates of mental health issues such as depression, anxiety, and suicidality compared to their cisgender heterosexual counterparts. Discrimination, stigma, and lack of culturally competent care contribute to these disparities. As of 2024, mental health issues among LGBTQ plus youth remained a pressing concern, backed by several studies and reports. According to a study published in the Journal of Adolescent Health, LGBTQ youth are almost 3 times more likely to contemplate suicide than their heterosexual counterparts. The minority stress theory explains that LGBTQ plus individuals experience chronic stress due to stigma, discrimination, and prejudice. This stress significantly contributes to their elevated rates of mental health issues. Research by Mayer in 2003 extensively discusses how minority stress affects mental health outcomes in LGBTQ plus individuals. These individuals and allies continue to advocate for policies and services that address the unique mental health needs of the community. This activism is essential for promoting systemic change and reducing mental health disparities. Studies have shown that support and community acceptance play crucial roles in the mental health of LGBTQ plus youth. According to the American Psychological Association, supportive environments and affirming relationships can buffer against the negative effects of minority stress. Access to competent and inclusive mental health care remains a challenge for many LGBTQ plus youth. The National Alliance on Mental Illness reports that barriers such as discrimination from healthcare providers and lack of culturally competent services prevent many LGBTQ plus individuals from seeking and receiving adequate mental health care. Efforts to address these issues include advocacy for inclusive policies, educational programs to reduce stigma, and the promotion of LGBTQ affirming mental health services. Ongoing research and initiatives are crucial to improving mental health outcomes for the LGBTQ plus youth in the future. In conclusion, while there have been positive developments in LGBTQ plus mental health, challenges remain. By fostering awareness, promoting inclusivity, and advocating for systemic change, we can look towards a future where all LGBTQ plus individuals have access to mental health care support they deserve.
That was a lot of great information and resources. Hey guys, if you know of anyone who could benefit from these resources, feel free to pass them on. Well, that about wraps up our episode. As always, if you're wondering how you can help, you can join our coalition meetings. You can also support our youth and family programs with a tax-deductible donation or food gift cards. And if you have any questions, you can email us at info@reachcouncil.org. That's info@reachcouncil.org. Or you can follow us at Reach Council on Facebook or Instagram. Thanks for listening to our show. Stay tuned for ongoing monthly podcasts from our Reach teams on all things prevention and recovery. So remember, life is full of choices, so choose happy and choose healthy. Bye.